So welcome today to our presentation. The title of our presentation is More Than a Visitor, and it's care planning in a changing environment. We have today, we're presenting, co-collaborating Family Caregivers of British Columbia with, and if you want to give a wave, Licia and Wendy, they're from Family Caregivers of BC, and we have Sarah and Mariana that are from Alzheimer's Society of BC, and myself, Kate Landreth, that is also from Family Caregivers of BC. So first we want to start, we are aware that there currently is a private member's bill called More Than a Visitor Act proposed in Ontario. Although we have a similar title, this presentation is not connected to that bill. And also both FCBC and the Alzheimer's Society of BC are presenting as nonprofit organizations, and we're supported by the BC government in different ways. However, we do not work for the health authorities or make decisions regarding care services or rules around visitation. So just something to note as we move forward. Some of you have already asked and you're getting familiar maybe with a new platform. So thank you for maybe a little learning curve. So your microphones are off today and your cameras are off. So you can be comfortable at your home. You can explore the chat box and the Q&A. And those are two features we'll be working with today. And also to let you know that we did receive questions from you and we thank you. We are hopeful that these questions will be answered through our webinar today. And for more specific questions that we did receive that are in relation to your care recipient and a care home, we encourage you to go and speak with any administrator in that care home to give you specific answers. So we see that many of you are joining from different areas today, and I'd like to take a moment to acknowledge and thank the Lukongan people, also known as the Songhees and the Esquimalt First Nations communities, for allowing us to live and play on their beautiful lands. And if you are in a different area, just giving acknowledgement of the territory that you might be on today. So a little bit about us. Family Caregivers of BC is a nonprofit charity, and we're 100% dedicated to the well-being of unpaid family and friend caregivers. We've been around for 30 years, and we're the first of its kind in Canada, and only 3 provincial organizations across Canada. One of our mandates is education, and that comes in the form of webinars like this. And we'll provide you with lots of resources at the end that you can explore on our website and on our social media.
Yeah, and about the Alzheimer's Society of BC, so we are a nonprofit organization as well, and we're committed to supporting people affected by dementia all across the province in different areas. Just on the screen in front of you, you see some of our current programs. Our in-person programs are suspended right now because of COVID, but we do have some adapted virtual programs. So we have tele-support groups right now for caregivers. We have webinars every Wednesday at 2 p.m. If you miss them, they are recorded and put it on our website within a week. We have our First Link Dementia Helpline where you can ask questions or get support, register for programs. That's available Monday to Friday from 9 to 8. The phone number is also in a document that we'll provide for you in the chat box and after the presentation. And we also have a series of newsletters, which you can sign up for by visiting our website.
Wonderful, thank you, Sarah. And that is great to just acknowledge that we are recording this webinar and you will get an email tomorrow with the recording as well. So what you're going to learn and explore during this webinar, we're going to cover essential visits and essential visitors, patient rights related to visitations, and tools for strengthening your caregiver's voice, and the importance of backup care plans.
Great, thanks, Kate. Let's start by talking about visitation in BC. The COVID-19 pandemic has significantly changed the rules around visitation to hospitals, long-term care homes, and assisted living. These rules have been put in place by the Ministry of Health as recommended by the BC Provincial Health Officer. I'd like to provide a quick overview of what has happened this year so far. In March, we saw the introduction of the essential visitor status. That meant that you were only allowed to visit if your visit was deemed essential. For example, if your visit was for compassionate care, and that includes critical illness, palliative or hospice care, or if your visit was paramount for the patient or the resident's physical care and mental well-being, that is, you provided assistance with feeding, personal care, or supported decision-making, then you had a better chance of qualifying as an essential visitor. At this time, essential visits are limited to one person per patient, client, or resident within a facility at a time. However, there are exceptions, especially in the case of palliative or end-of-life care, and it's up to the discretion of that facility. Now, at the end of June, we saw a change to the visitation guidelines to support visits between family members and residents of long-term care and assisted living. There are several rules with social visits as well. For example, all visits must be booked in advance with the care home. And at this time, only one designated visitor is allowed for social visits. There is an assumption, however, that restrictions are the same across BC. The Ministry of Health has some regulations that must be followed, but the rest that have been provided to care homes are recommendations that they can choose to adopt at their discretion. Sort of like how we're seeing daycares, schools, and adult day programs across BC are adopting guidelines and look different across BC. That's why we're hearing that some caregivers are allowed a 30-minute visit per week, and others are seeing 30 minutes maybe every 4 to 6 weeks. This distinction is very important as it highlights the director of care as the main point of contact prior to going to the health authority or to the ministry with concerns around visitation. Go to the next slide. What the changes in visitation guidelines have taught us is that things can change. It's safe to say that we're likely to experience more changes in the months to come, especially as we're heading into the winter and flu season and as cases in BC are currently rising. What that means for caregivers is that you need to be as prepared as you can be. You might not be able to control the visitation guidelines, but you can control how the visit times allotted to you are used, and you can build stronger relationships with the healthcare teams so that your voice is heard. Another way to think about planning during COVID is using this bus metaphor. You buy a bus ticket, you have it ready, but you don't know exactly when that bus will come. You might have the bus schedule, which is your plan, but sometimes that bus comes early or maybe it doesn't show up at all. When you board the bus, you find that there's much more traffic than you expected, or the bus suddenly needs to take a detour. You have absolutely no control over the situation, but you trust that the bus driver is doing the best that they can to get you to your destination on time. While purchasing your ticket in advance and having it ready to go for when the bus does show up is kind of like having a backup plan in place. Even though events may not unfold exactly how you've prepared for them, you're still much more likely to get to your destination than if you did not have a ticket to get in the bus in the first place. It's really about being ready and being open to changes along the way. I now want to share with you some of the things that we've been hearing from caregivers. Overall, caregivers really understand why the current restrictions are in place. Over the last 7 months, we have heard a lot about how people appreciate the efforts that staff have been making to facilitate window visits, virtual visits, or in-person visits for designated visitors. And families recognize that staff really do care, and they are doing the best that they can with the restrictions that are in place. In speaking with caregivers from across BC, we are hearing a range of emotional experiences. On the positive side, some have shared that they feel like they now have permission to take a break because they're simply unable to visit as frequently or as long as they did before. So expectations that they may have placed on themselves have now been lifted. This might even allow them to find a new identity outside of being a caregiver for the first time. Some have also come to realize that their need for visitation might actually be different than that of the person that they're visiting. Depending on where a person living with dementia is at in the disease, their concept of time and threshold for stimulation may have changed. So while some caregivers truly miss having those long visits that last hours, for the person living with dementia, a short 30-minute visit might be just as meaningful. So while we understand that for caregivers, waiting for weeks to see the person again can feel like an eternity, for the person you're visiting, it might only just feel like a day. Now, on the other side of experiences, the inability to continue to provide care has been quite traumatic for many, many people. Milestones have been missed and worries have risen, particularly for those who were highly involved in the person's day-to-day care before COVID hit. While we unfortunately don't have the time to get into all these stories we have heard, we will spend some time talking about your rights as a caregiver. We're going to actually take a moment right now to read out a scenario to you. As you listen to this scenario, I'd like you to think about what you think the caregiver's rights are in this situation. So, well, yeah, great, thank you. Bob was offered essential visitor status upon admission of his wife into long-term care. After 2 weeks, the status was withdrawn and he was told he could no longer visit. Bob had assumed the decision was recorded in a care plan, but has not been able to see the care plan or any documentation on the decision. Bob spoke with the staff and the director of care before filing an official complaint with the health authority. Bob insists that he is an essential visitor as his wife has behavioral problems in the dining room and is not eating at mealtimes without his support. So we're now going to post 2 poll questions to ask you what you think Bob can do in this situation. So Kate, go ahead and put up the first question. And the question reads, can Bob ask to see the care plan? Your options are yes, no, or I'm not sure. And we'll give you a number of seconds to provide your answers there. And Kate, when you're ready to share the responses, I'll let you take the lead on that. Great, wow, 92%. The majority of you say yes, he can ask to see the care plan. 1% no, and 8% I'm not sure. And the answer to the majority of you are correct. Yes, so long as Bob is a supportive decision maker, which should be recorded on his wife's healthcare record. If you are a supportive decision maker, you need to have access to the same information that the care team can access in order to make informed decisions. Now, why is seeing the care plan or the healthcare record in general important? Well, that'll give you the ability to have an opportunity to discuss key decisions made and understand how the care is being delivered. It will help you problem solve with the care team to provide different approaches or considerations. Like in Bob's case, maybe you provide some information about how best to support his wife at mealtime or support with the changes in behavior. So now we're going to post one more question. And I'll just wait for, great, thanks, Kate. And the question number 2 reads, does the care home have the right to change Bob's essential visitor status without notice? And your options are similar to question number 1. So is it yes, no, or I'm not sure? And maybe Kate, hopefully we have some responses by now. Great, thank you. So this is a bit more mixed. So we have 25% of you said yes, the care home does have the right to change his essential visitor status without notice. 48% of you said no, and 27% say I'm not sure. And the answer we're giving here is technically yes. If you're lucky enough to get essential visitor status, and we've understood that that's not always an easy case, you're given a time frame or a date of review. It would be helpful if you're proactive and you let the care home staff know that the review date the review date is coming up to request further information rather than letting it expire, which is probably what happened in Bob's case. If you get essential visitor status, ensure you follow all the rules, including wearing personal protective equipment, and make sure that you make the most of it. For example, at mealtime, Bob can share his observations about what works well or what doesn't with his wife, and he can share that with the care team so that when he's not there, they can support the person in that same way. Planning ahead is also important. Stay informed about the care home processes in terms of determining essential visitor status. Ask about how long you have it for or when it could get canceled. For example, consider that if there is an outbreak, the care home will be closed to all visitors to contain the spread of the virus, and the outbreak isn't declared over until there are no positive cases for 2 weeks straight. Thanks a lot for your participation in the polls. And we'll end this section by just talking about some rights and restrictions. So according to the Resident Bill of Rights, which outlines some of the rights that residents living in care home facilities can expect, residents living in long-term care have the right to receive visitors and communicate with visitors in private. However, in practice during a pandemic, which is a public health crisis, the restrictions for visitation that have been set in place supersede the rights of individuals. The reason for this is to promote the health and safety of all residents. Long-term care is home to many people. It's a shared home with a lot of different people who live, work, or access it. That is, the residents, staff, family, and friends. For those who live in long-term care, it's a place that needs to feel safe. So when it comes to making decisions about visitation during a pandemic, we need to think about it as a communal home. At your home, your house, you don't want visitors coming and going during a pandemic. So that same principle applies to a long-term care home. Caregivers need to do their part in working together with healthcare providers in following rules and preventing the spread of COVID and future outbreaks. That means share your concerns with the staff on site, but also be proactive and offer solutions. For example, there might be an opportunity to volunteer with your organization and support visitation through planning or scheduling.
Hello, everybody. Here is Licia from Family Caregivers BC. Thank you so much for being with us today. It's a great honor to be here together with you. And I think we're all in this journey together. Here at Family Caregivers of BC, caregivers are considered essential partners in care. So for us at Family Caregivers BC, the important role of family caregivers is actually grounded in the evidence that shows that caregivers play a critical role in providing physical and emotional support to a family member, a partner, a friend, or a neighbor in need. And I guess you all know that so well. I'm just repeating things that are so obvious for all of us. But we need to make sure that when we are meeting with healthcare providers, it's always important that we know how important our role is as caregivers. Our presence in the care of our family members, our friends, means that we are helping them to have a better health when we are together. So this includes, for example, decreasing anxiety during procedures, prevention of falls, improved transitions, and understanding of discharge instructions. So visiting policies that are not accommodating and not involve essential partners in care, it can actually increase anxiety and can result in inconsistent patient care. And sometimes it also means withholding of needed treatment while in long-term care. So I'm sure you all are thinking about solutions and what you can do to increase connections with your loved ones in long-term care. So if you have not already done so, it may be helpful to begin a conversation with the healthcare staff or management team in regards to your concerns related to the well-being of the care recipient. So if you are having ongoing concerns, and if you already tried so many options in terms of conversation with the healthcare team, it may be helpful to follow up with the administration of the facility in writing. So once you have this writing and this becomes a legal document, and you can state how you feel, how you fit into the essential visit category, and share the BC Center for Disease Control restrictions about essential visitors. Because at this moment, we know that each facility they are doing they are following inconsistent plans. They're not really 100% consistent with the directions from the BC Center for Disease Control. So it's very important to have this document in place. So if still your concerns are not solved, if after this conversation your concerns remain unresolved, you may want to consider following up with one of the two ways. One is with the local medical health officer in your area. And we have a list. I'm going to share with you all this information we are talking now. Or you can also connect with the patient care quality office for your health region. So Fraser Health, Vancouver Coastal, Island Health, they all have their own patient care quality office, and it's important to follow up with them about your needs. You may also find it helpful to take our new caregiver course available right now at our website. It's called COVID-19 Social Visit Essentials. This is a way to support the health and well-being of yourself and others as you continue making visits to long-term care. So the other question that many people ask us, I work in the support line, so I work with one-to-one providing support for caregivers. And one of the questions we have almost every day since COVID started is that they ask, should my family member go to live with me or with a family member, or stay in the long-term care or nursing home? We have these questions all the time. So what we are providing in terms of information is that it can be very hard to decide about living a long-term care or nursing home during the pandemic. So we are providing a document that was actually, it's from Ontario. This document is called Decision Aid, and we will share this information with you after the webinar. This document highlights 6 steps about this specific decision. The first step is the question, why are you thinking about leaving your family member's current place of care? So that's a good question to start. The second question is, what care is required and who can provide it in the family home? Then the third question is the family home safe and can be required? Care needs be given there at home? And then the fourth step is, do you know the new rules of discharge and readmission due to the pandemic? The fifth question is, which reasons to choose each option matter most to you? And the last one is, what else do you need to make a decision? How comfortable do you feel making this decision? So this is an important steps. These are important steps to consider. And our team will be happy to share this document with you. And I want to thank you so much for being with us today. And my colleague Wendy will continue our webinar with you. Thank you.
Thank you, Licia. It's Wendy Johnstone here. The 2 slides I'm going to speak to are going to be strategies for caregiving in long-term care. Before I dive right in, I do want to acknowledge that it's incredibly challenging when it seems like there's different rules for different facilities. There might be we might feel there's some exceptions made for, we hear of one case or a different case. And so it can really make it challenging for us as family caregivers, because in some ways it feels like we don't have any control over the situation. And so I just want to acknowledge that that's incredibly challenging. There's also differences across the province based on different policies within long-term care facilities, as we had already mentioned, in terms of there's certain guidelines that long-term care facilities have discretion over and other ones where they don't. So I just want to acknowledge that it's a very, very challenging time for all family caregivers, especially when we don't have access to our loved ones in care. There's been some good research around what are the most effective strategies for caregiving in long-term care. And there's three main components. The first ones are the aspect of navigation, and that's really understanding the rules and policies. The second one is seeking information and arming ourselves with good information. And the third one is how do we use that information to help navigate and then use it to better inform or better direct our decisions going forward. So one of the first ones, which I think we've touched on, is really understanding what are the specific rules and policies within the long-term care facility in which the person you're caring for is residing. And those rules and policies are going to apply not only to current visitation rules around COVID-19, but also even really understanding some of the other rules and policies, like, for example, some long-term care facilities have volunteer programs where those volunteers are able, to enter the facility and support certain activities. What are some of the policies around the number of calls you can have with your loved one, using video conference? When are the best times to connect with the right person, whether it's the care administrator, whether it's the nurse, practitioner and lead, or the clinical lead on the floor. Really kind of understanding how that long-term care facility operates as a whole will really help understand where best you need to seek more information, and then how do you use that information to best advocate for the individual that you're caring for. So the second one is this idea of seeking information. The other thing I do want to acknowledge too is that we understand that throughout this presentation, essentially what we're also asking or reinforcing is that as primary caregivers, family caregivers, all of this requires more emotional energy and more emotional labor. And so we do recognize that in some ways we have enough on our plates, and now we have to do more around seeking information. And yet it is the best way to be able to advocate for the people that we're caring for. But we want to acknowledge that we understand it takes more time, it takes more energy. So seeking information, we want to be able to find information formally, and that really comes down to the rules and policies. It's getting as much information as you can and in writing. I think sometimes also it's really important to understand, don't expect communication from long-term care facilities to be, consistent and clear. They're doing their best, but not having that expectation, I think, helps keep our expectations in check. Taking on that responsibility as well to clarify and to communicate and to ask is one of the most successful ways to be the best advocate for the person we're caring for. Also, talk to other family caregivers and see what's working for them within that facility. Where are they having challenges? And be able to seek that information out from others. Be able to actually talk about what you're thinking about asking for, writing. Ask another family caregiver, to help listen out or to help you clarify or support you in that decision making. Those are some ways to really understand how best to seek information. The other thing we find too is that being able to recap a meeting that we've had over the phone, over the email, with a follow-up email is often a really great way to make sure that we've got good documentation of conversations, and to really be sure that we're hearing the information as it's being presented. The last strategy is around this advocacy. And one of the questions we like to ask family caregivers, and there's not a single ounce of criticism when we say this, but really understanding who is the best person to be that advocate for the person in care. So sometimes families have, a number of family caregivers that are part of the care team. Designating one individual to be that primary caregiver and maybe the primary correspondent is something to review and consider as a family. Also, knowing this idea of how best to communicate with the care facility is really important as well. And so, is it best to have a phone conversation first? Who is the best person to speak to for your concern? Is it the long-term care facility administrator? Is it, if it has to do with the care plan, speaking to the nurse or the clinician in charge of those care plans for the person that you're caring for? How do you best connect with them? Is it by phone? What are the days that they're working? Having that level of detail and having it written down in one particular spot can really help us ensure that we don't have to work at thinking about all of those extra pieces. So those are some of the three main areas that we look at for strategies, and I'll have someone go to the next slide, please. So how best do you use your voice for your loved one and for yourself? This idea of working towards building cooperative relationships is really about this idea of being a team member. And we recognize, again, that this requires emotional labor on our end as family caregivers. One of the best things that we can do is be really proactive in how we document our concerns and understanding that the emotions around caregiving really vary from individual to individual. When we're documenting our concerns, it is really important to be as objective as possible and to use that information in a way that can work towards a proactive solution. Using that voice, as we mentioned, around being specific, finding the right person to connect to, and keeping one place for all of your correspondence is really, really important. This idea of also being a voice is this idea of, again, checking back in for, are you the right person to be, do you have the time and energy to be a voice for the individual that you're caring for? How do you need support in order to take on that additional role, or how do you find support to support yourself as a family caregiver as you work towards advocating for the person that you're caring for? The third one is around being prepared. And we've just touched on this a little bit around preparing questions in advance, writing them down, listing your most important questions first. This idea that sometimes we can approach a concern as a discussion or a question. Sometimes having a discussion can provide this element where it is more around looking at solution-based and looking at ways that the whole team can provide information around how best to work towards a solution. This idea of keeping a written record is really important of some of the questions you've asked, the answers, the various contact informations, the dates. That's a really important piece because it helps give context and puts the situation in a timeline and also shows progression, either solution-based or if there's been changes to a healthcare situation or worsening, then being able to document that is really important. Being realistic. Trying to collaborate with others is not easy work. We often ask family caregivers to think about this question, and that is, what's acceptable? We understand that we all want the best possible care for the people that we love and that we are being advocates for. It's also asking ourselves, what can we live with? What's acceptable? And in trying to find that balance between the two. One of the other ways is also trying to be very specific and clear about how you need help or how the person you're caring for needs help. Sometimes it's really hard because healthcare providers or the staff at long-term care facilities, they're following policy directions. And so it can be often very difficult for them to make changes without having to seek further approval or further discussion. So understanding that there's a process involved, and knowing that the type of question that you want to ask, making sure you're asking the right person. And so that's often one of the very first questions, to ask is when you're working with staff or a healthcare provider, asking them, what can they help you with? What scope of decision making can they help you with? The last one is around being persistent and kind. Similar to what Dr. Bonnie Henry talks about being kind and patient. Everyone wants to find a solution, and being proactive and solution focused can be very helpful. This idea of being willing to listen is also really important. And the other piece into that we find very helpful is, as family caregivers, doing a check-in before we call, checking in with how we're feeling on that particular day. Not to give up. Persistence takes work, and yet it will certainly yield in results. It may not always be exactly what we want, but it comes back to this idea of understanding, what can we live with? What is acceptable? We'll go to the next slide.
Hi, everyone. Another voice here. I'm just going to leave my camera off. I'm quite animated when I talk, and I've been told it can be kind of distracting sometimes. I want to put this to the chat box so that we can take a moment now to think about what are some of those unexpected events that could prevent you from caregiving. So if you're comfortable and you have your chat box open, if you don't mind just, typing a few thoughts and thinking about some of the things that might arise. And for the chat box, I noticed there's different too, so you can select 2 panelists and attendees, and that way we can all see your responses as they come in and benefit from seeing the responses of each other. Okay. And just while we're waiting for that to come in, some of the things that we've heard are that, you can become ill. You or the person you're caring for gets admitted to hospital, or their care needs change, or you need more support managing their care than what you're used to. Perhaps there's a personal emergency and you're unable to visit the person during that prize visitation time that you have. Maybe there's an outbreak in the care home or bad weather. There's all these things that can show up that are unexpected and can inhibit us from providing the care that we want to provide. Okay, our healthcare system requires a lot of moving pieces working together, and we've seen that there truly is a lot outside of our control when it comes to a public health crisis like this pandemic that we're in right now. Kate, if you can take us to the next slide, please. Now, I also want to note that the plans you put in place will vary depending on your family situation. So we're going to talk a little bit about backup plans here. And I want to be clear that I'm not just referring to the usual formal financial and healthcare planning documents like that power of attorney or representation agreement, because this is an advanced care planning webinar. But I am going to talk a bit about those informal tools that we can put in place, such as the Ready Set Plan for Care Partner Absence document. We have an image of this on the screen for those joining by phone. I'm sorry that you can't see this, but this document is included in a list of links that we will be providing later on in the webinar and afterwards as well. These documents can really help you to identify those areas in your life where a plan would be beneficial. So for example, if you live with the person with dementia and you're the primary caregiver, think about who will provide care for the person if something happens to you. How long could an alternative person provide care in your absence? And would they realistically have everything that they need to step in at a moment's notice and continue with the person's daily routine, which we know is so critical if you're living with dementia? Or would they be unsure of where to start or who to call? Okay, so one area where we can start is that it's helpful to write out what a normal daily routine looks like for the person you're caring for and the strategies that they respond to best. If you do have those formal legal documents in place, make sure that trusted family members have instructions on where exactly these documents are located and how to access them if they're needed. And Kate, if you don't mind just sort of throwing up all the bullets there, that'd be great. Another thing you can do is pack a ready-to-go bag, and you can keep this in the trunk of your car, or if there's space for it, you can keep it in a closet in the entryway so you can grab it on your way out the door if a hospital stay is needed. And we do have some suggestions on items that you might want to include in a ready-to-go bag, again, in the resources document that you'll be sent. And some families find it helpful to create a resource book where you can list all the personal and professional contacts like phone numbers of family and friends and healthcare providers, so it's at your fingertips when you need it. And I know Licia and Wendy have already talked about this quite a bit, about the importance of having those conversations with others in your network and making a list of who is available to help and what specifically they can help with. So such as a niece or nephew who might be able to interview various private care agencies for you, so you have a backup agency in mind if any of your current services are suspended. Okay, so this way, if you do end up needing this information later on when there's a time of crisis, you might have just saved yourself the step of trying to identify a suitable care provider while under pressure. And we know that stress can cause us to miss important details. So nice to have this done in advance. Oh, and I see in the chat box that someone had said it's kind of like preparing to go to the hospital when having a baby. Yes, absolutely. So planning for all times in our lives. Sharing our plans and the important documented information with anyone who will be a backup care provider is also very important. So again, they're able to just jump in at that moment's notice. They already have the plan available to them. And again, if they don't know where the information is kept, then unfortunately, it doesn't mean anything in a time of crisis. So we have to tell people where exactly these documents are. And I also want to encourage you to consider if language might be an issue. So if language is spoken at home, if another language other than English or your native language is spoken at home and you're supporting someone who speaks English as a second language, consider those emergency situations where they might be alone and need to have instructions in English to pass along to someone else, like a first responder. And we find that even if the person is quite fluent in English, the stress of the situation might actually make communicating that important information much more challenging. Okay, so again, nice to have it all on paper so you can just hand that right over. Okay. And so the resources document that we'll be providing to it has a whole page of links that will give you more information on the visiting restrictions, suggestions for when you do visit a person in care, as well as tools to help you put these plans in place. But I want to note that there is a lot of information in this document, so please don't feel like you need to print it all out and complete everything. Just have a look and see what applies to you and your situation, and then use the tools as suggestions for what might be helpful for you and your family member. Okay, and on the next slide here, so I want to pose a question to you because we've talked a bit about how to put a plan in place and what we should be planning, but as many of us have realized, sometimes we still just don't get in place all the plans that we would like. Okay, so you should see a poll up on the screen there. I'd like you to select what you find difficult about planning, and you can select more than one answer if it applies to you. But think about if there's any barriers that stop you from putting in place all the plans that you would like to have. And the options available are, I don't know where to start, I don't have the energy, I don't have the time, it's hard, it's expensive, I've never been a planner, or something else. And if you hit other, I'd love if you can share with us in the chat box what that might be. So we'll just leave this for a few more seconds here so you have a chance to select your responses. Okay. Right. So it seems like, yeah, a lot of people, we just don't know where to start. Absolutely. I've heard this from quite a few people that it's almost like learning another language. You really have to get used to the lingo that's used and where to go and who to see. It's a lot of information. And your caregivers, you're tired. You don't have the energy to learn a whole new language of, advanced planning or putting other plans in place. You're busy. Yeah, it's a lot of time. It's hard, it's expensive, and it's just not something that we're comfortable with. Yeah. Great. Yeah, so I do want to note, because I'm seeing this on the screen here too, and thank you for doing our poll there, that if you are feeling frustrated because you don't know where to start or what to do, or you're just too overwhelmed to even think about what the next step could be, as we saw just now in the poll, that you're not alone in this. Others are feeling this too. And most people do find planning for the future to be challenging. And I want to know, it's not that you're doing something wrong or that you're not capable. It's just that it really is that hard. It's okay to seek help if you're unsure of what to do or where to go next. And lots of you have come here today, so you've already taken a good step there. Okay, and we've provided some great planning tools to help you get started in our linked resources again for you. I do want to note that we don't have it on that resources document, but there is a great organization called NIDUS, N-I-D-U-S, that provides information about advanced care planning. I'll put that in the chat box there at the end of the presentation so you can look that up. Okay. And yeah, so again, I want to note a backup plan does not have to be an erroneous task. So you can start small and keep it manageable. So for example, if you as a caregiver get admitted to hospital, is there someone in your network who you can share updates with? And then they will be responsible for updating the whole family. If you don't drive, who will be the person that drives you to and from the hospital? So thinking about these plans are free and can be completed with a conversation and a simple written document. And you'd be surprised how much stress it can take away in a moment of crisis. Okay, so your first step might be to write out a list of the plans that you would like to put in place and the people in your life who could help with some of these plans. Okay, and keep in mind that planning is a skill, and just like any other skill, the more you do it, the easier it gets. And if you know of other caregivers, ask them if they developed any tools that help them organize their plans, and if they can share those tools with you. So caregiver support groups are a great place to get those insider tips. And for some people, the expense of putting together those formal documents can be a barrier in itself. But I just want you to consider that in some cases, the cost of not having a plan or that appropriate documentation initially can end up being much more costly later on when you're trying to put in the plans when they're needed. And we often see this in the case of comiteeship. And also just remember that planning for the future is not an all or nothing event. So most plans, again, they evolve over time as you have those conversations with family and friends. Okay, we know that dementia progresses, caregiving needs change, preferences or wishes change, and so do the plans that we put in place. Okay, and because plans evolve, it's best to put plans into place as early as possible. And we might like to think that there's always more time to get something done until there's not, and we're faced with an unexpected hospital admission or move into care that happens right before you get that last signature on a document. And Kate, if you go to the next slide, please. If you don't know where to start, ask questions. So again, we've spoken quite a bit about this today. There's power in questions. So for example, if the person's admitted to hospital, call the unit where they're admitted and ask, who's the designated person that I can speak to for updates and how often can I expect to hear from them? Okay. And before a person moves into care, we often advise caregivers to be the squeaky wheel. That means being politely persistent in calling your case manager and putting those supports in place. Now, when a person moves into care, this often requires a bit of a strategy shift. So we suggest being selective with your questions and the timing of them. And as Wendy spoke to, about picking your battles. So consider if your question is critical to the person's care or your own overall comfort with the situation. And think about how your question might affect the relationship with the care team. Is it urgent or can it wait for a care conference? Okay, do your best to balance questions and concerns with the positive feedback to the care team. Again, try to see it from their perspective and assume that they're doing their best with the resources that are available to them while keeping within the procedures that are in place. And please don't forget to take time for your grief. This is something we hear so much about. It comes through in all areas of our life. Try to consider if your feelings are coming from a possible disconnect between your expectations for how the situation would be and the reality of it now. Okay? If you expected that you'd be able to visit the person in care every day or on a regular schedule, and you're now unable to do this because of the restrictions in place, then it completely makes sense that you might feel unsatisfied or angry with how visitation is going. It's not what you had expected. Okay? So Leisha spoke to this, the question that we hear all the time: should I just take them home? Again, this is a very individualized and personalized decision. Unfortunately, we can't make this for you, but we can encourage you to assess what resources you have available to you prior to making the decision. And consider the reasons that led to the person moving into care in the first place, how you felt when you decided it was time. And are these reasons still valid today? Okay, and again, we have those decision aid tools and the resources documents that can really help you to explore this decision a little bit more. But we spent a lot of time today talking about how to ensure that the person you're caring for stays cared for. But what about you as the caregiver? Okay, so we love our car analogies, so I'm going to use another one. When a car runs on fumes, it sputters and it kind of chugs along, and you drive it with that constant fear that you'll stall on the road at any moment. And so think about how you're doing. Are you chugging along to get through the day? Or do you have enough gas in the tank to keep on driving? And if you do, how much gas do you realistically think that you have left? Do you have what you need? Okay, now think about what it is that gives you the energy to keep life in better balance. And how do you top up your tank? Okay, so I want to make sure that we have some time to get to questions today. So I'd like you to think about this, and if you're comfortable, share it with us in the chat box, and we can sort of share those strategies with each other. And then I'll just pass it back.
I will in a moment just drop some of our documents into the chat box, but just know that they're links that you can access. Tomorrow you'll get an email from Zoom that will also, or from this webinar, that will have the same links, and also our evaluation. So our evaluation is for this webinar today, and we really encourage you to do this. Not only is it helpful today just to understand how this landed with you, but also it informs our future webinars and educational resources, because we want to meet your needs. On the next slide, this is our contact information that you can see here. So our call number for our caregiver support line, and then the hotline for the Alzheimer's Society as well. Okay, I'm going to ask the presenters to come on in video. I'm going to stop sharing so we can see our faces. Wonderful. And we have many questions. Some of you, I am so happy that caregivers are always so generous in sharing their own personal responses to some of these things. And Sarah and Wendy and Mariana and Licia, you've all hopped on as I've navigating slides, looking at chat and Q&A. So I thank you. Just to note, there is 171 of you on today. And so we are thrilled that you're here. Okay, to start. I'm going to start at the very top. I'm just going to let 1 second. Wendy's camera.
And while you're doing that, I noticed a comment in the chat box from Carla, and they're coming in quite fast and furious, which is great. So if we don't get to them, I apologize. But Carla had noted that she's recognizes that everyone's doing their best, and she's been told many times that her expectations are too high, and this gets frustrating. Absolutely. I mean, when you don't feel like you're being heard or your concerns are being validated by the care home, it can be very challenging. And I think it was Wendy who spoke to sort of thinking about what is within the capacity of the care home and what they can do to support. And sometimes finding that alignment really takes documenting what your concerns are and being very succinct, articulate, and bullet points even in a letter if you need to the care home about what your concerns are and why they're a valid concern, and then passing that over and just even acknowledging to them that you recognize that their hands are tied and that they're doing the best they can, and that can really kind of help you find that common ground and maybe bring down their sort of, I don't want to say dismissal, but have them address really how it is that you're feeling and your concerns there. Yeah. So I don't know, Mariana, I don't know if you wanted to speak to this a little bit more. You work quite a bit with healthcare providers.
No, I think you managed that one well. Just being mindful of what the care home is experiencing, as Sarah said, and being thoughtful of your approach with it, having your questions ready, and as much as you can, not having, I know it can be difficult, but just not having that kind of bringing your emotions down with certain situations and trying to be as professional as you can. That would be my only 2 cents to add to that, but thank you, Sarah.
Mm-hmm. Yeah, and that emotions piece is so hard. You know, we kind of have to like keep it together and put the cap on when we go into that conversation, and then you leave the room and the cap comes off and all that emotion floods out. That's why we have those helplines. So you can call and just say, oh my goodness, I just had this conversation, and you can unload with us and we can talk through it with you. And that goes for Family Caregivers of BC and the Alzheimer's Society.
One thing I just might quickly jump in on that end, and thank you, great, I think a great review around this idea that we're not acknowledging the emotions of the situation. I think it's really important to understand that that's what we're here for. Is we're happy to hear your concerns and your frustrations, and we urge you to call us. That's what we're here for. I think the piece that sometimes, so sometimes it feels like we're very cold and calculated when we make the recommendations to be as objective as possible. And yet really that's how our healthcare system is designed. It's designed really to take a look at the information that's very pragmatic and then to try and find a solution with it. And so it's not that we don't value the emotional piece. It's around the importance of trying to tease out the information that's really the most black and white to help the care recipient and yourself get what you need. And to have the emotional piece still be acknowledged and validated through a different source. So sometimes it's just knowing, how do you best support yourself, and having someone help you say, let's talk about the emotional piece and the objective piece, get that stuff in writing and work with your healthcare providers. So I just wanted to add that little bit.
Mm-hmm.
Okay, I'm going to share just a few. I'm looking at kind of the chat and the Q&A, and there are some similar ones. So the first one is it one designated visitor at a time or only one visitor per resident?
I'll take a crack at that. And by the way, we do have a link in our resource document to the visitation guidelines so that you can read it on your own time. But at this point in time for social visits, it's one designated visitor per resident, per person. So I think there was another question there. Perhaps I was reading very quickly. I think it was a situation where the person wasn't sure if they could go and pass it on to another person. Understandable situation, and I'm sure a lot of people are wondering that question. That would be a conversation to have with the care home on that. Unfortunately, you do have to speak to them about arranging that. But at this time, it's one designated visitor per resident or per person. I don't know if anyone wants to add anything else to that.
Very important to note that the facilities are having inconsistencies sometimes. So it really varies a lot, unfortunately. I know some places that they're not really allowing anyone to go, and some places they're flexible with 2 people. It's very tough today in terms of this kind of inconsistency we are observing in facilities.
Absolutely.
Unfortunately, that's the reality.
So it comes back to, each care home, each facility there's a lot of factors that come into how they're able to support visitation, whether it's staffing, for example. If there's a lot of people on sick leave or whatever reason, those factors kind of influence how they're able to support visitation. So that's why I guess it is important to speak to that care home about how they're able to apply the rules or the guidelines. Thank you, Alicia.
I have another question here that asks, do emails to staff or managers at long-term care facilities qualify as legal documents, as you touched on, for keeping track of communication?
That's a good question. I'm not a lawyer, but we are planning to put together Q&A documents for all the questions that we can't specifically answer here today. So that is definitely something that we can find out and put in that Q&A document and send out.
Yeah, great question.
Mm-hmm. This is another good question. I'm sure that is something that is asked, but suggestions on how to articulate the why of not being able to have a loved one come back home. So how would you explain that?
Explain that to the person, or?
My understanding to their care recipient, yeah.
Mm-hmm. That's a tough one. It really depends on where the person is at. So yeah, assuming this is the person who is living with dementia in care at this time, we really have to get creative. So I mean, for some people, this is a great time for therapeutic fibbing. This is where we'd sort of play on their reality, not play on their reality, but really just go and meet them where they're at. So you might say, oh, you know, we're doing renovations at home right now, and, you know, everything's kind of in upheaval. It's just not a good time. If they're a little bit more aware of what's going on, you can be honest, just say, you know, this is the safest place for you right now. I'm going to do the best I can to visit when I can, because that's the truth. So you really have to see where the person's at and what they're responding to, and that can kind of guide you on how you would respond. If you do have more specific questions about that, though, absolutely, please call our dementia helpline, and then we can talk through it a little bit more in detail there.
Is the designated visitor the same person as the essential visitor?
Very good question as well. I think with this one, the way that it's been framed in the visitation guidelines is that the essential visitors are those people. So if you recall that very first slide that I reviewed with you today, the essential visitors are people that can kind of go in for a little bit longer period of time, perhaps, than the social visitation. So reminder of the essential visitor versus the social visitor, which is that one designated person per resident or patient. So when we're talking about the essential visitor, that time frame, the amount of time you're allowed to go in for, depends on each situation. So I think there's been other questions related to that about, you know, can multiple people be essential visitors? And again, sorry to say that there's no one answer here, but it depends on the situation. So, you know, an individual, for example, who is palliative, and that meaning defined as end of life, because palliative, that term seems to be quite widely interpreted as well. So if a person's at end of life, you might see the restrictions around visitation to look a little bit different than someone who might be essential visitor and going in to support with mobility or feeding or whatever the reason might be. So there's no one clear cut answer, unfortunately, with this question, but just wanted to distinguish between the essential visitor for those specific reasons and the social visitation, which is just simply to spend some time with an individual, and often you're seeing shorter periods of time for that. Hopefully I answered that question.
All right. Thanks, Mariana. That was great. We have many questions here, and I think as a team, we decided we're going to put out a Q&A document to help respond to some of these, knowing that we don't have the answers to all specific ones that might need to then be taken as a conversation to administration or someone that you can find in the long-term care for specific questions. But we in the next week we'll follow up with you with all that are here today with that Q&A response. Just another thing, because I see it has come in a few times on our chat, is a lot of encouragement to go to the NIDIS site that was shared today to start your planning and to look at the resources that they do have there. And again, there's been some chat since, but there is our resource links that I put in the chat box if you'd like to click on them just before we exit out, so you have them. But they'll also be sent out tomorrow, and our survey. So there's a link to the survey, and there's 2 links to our PDFs that have resources for you today.
And I just want to add an additional to the survey. It is very, very helpful for us to get your feedback on these topics to see if it's relevant to you, if there's anything else that we can provide in our scheduling of online education. So we really do listen to the feedback in the surveys and our planning. So if you do have a few minutes, we appreciate your feedback.
The only other thing I'm going to pop in very quickly before, and I know we're at the end of our time here, is there are some places where caregivers can use their voice to try and impact change on a larger level. And because all of your comments and all of your experiences are really important, you know, to be heard. So I think in that Q&A, we'll also list some of those places where caregivers can use their voice and experience to try and help make changes and make the future improve for other caregivers. So thank you for sharing all of your stories and all your personal experiences. We really appreciate it.
Just a quick note here. Thank you. I really appreciate all your information and your questions. we decided that this is a big area of support. We talk about emotional, challenges we have, sometimes they're not addressed. So I want to invite all of you to join our, we call is a specific support group for people dealing with this specific issue. We meet every last Wednesday of the month from 2 to 3:30. And that's a chance for us to connect with other caregivers, experience the very same situation. And more than ever, we need to be together. More than ever, I think. Thank you so much.
Thank you, Sarah and Mariana and Licia and Wendy for sharing your insight and expertise, and so well spoken. And also thanks for everyone that took the time today to join and learn, and hopefully maybe revisit some things that you already knew, and just remembering again, and knowing that you're not alone and that there's lots of people in this community that are here for you. So again, our support lines, both with Alzheimer's and with FCBC, is here for you. And I thank you for your time.
Thank you, everyone.
Bye.
Bye. Take care.
Bye.
Thank you.